Hello everyone. Today I am going to tell you how to perform the intraosseous insertion. This is the Competency PE 24.17. So today you will learn indications, what is the puncture site, what are the devices and how to perform the procedure, then complication, contraindication, and in last I will show you the checklist by which we will assess the student in exams. So what are the indications of IO insertion? In emergency situation, when venipuncture is difficult, example, if the patient is having cardiopulmonary arrest or septic or hypovolemic shock or prolonged status epilepticus or severe dehydration. In such a condition, reduction of circulatory blood volume, vasoconstriction, collapse peripheral vessels occur. So it will lead to the difficulty in the venipuncture. So we can insert the IO which hardly take the 1 to 2 minutes. So IOSS is indicated for the fluid and the medication whenever there is a failure to gain the peripheral venous access. Now what are the various sites for the IO insertion? Preferably we have to insert in the proximal part of the tibia. First we have to identify the tibial tuberosity, then 1 to 2 centimeter inferior to the tibial tuberosity and 1 centimeter medially we have to insert. It is a preferable site in the children because a thin layer of skin cover this region. Other sites are distal part of the tibia. We can prefer this site also in more than 10 years age group. In this 2 centimeter above the medial malleolus we have to insert. In adult, distal femur, anterior superior iliac spine, humerus and calcaneus are also the site, but we don't prefer these site in the children. Now the device for the IO insertion, various devices are available in the market but they are very costly. So generally we use the 18th gauge needle. So these devices are categorized into either manual devices or automatic devices. So IO gem sheeting needle is the manual device and bone injection gun and EZIO is the automatic device. So now I am going to show you how to perform the IO insertion by the 18th gauge needle. So here in this video you can see the first step is we have to identify the site of IO insertion. So in this video you can see first we have to identify the tibial tuberosity. Then after identifying the tibial tuberosity 1 centimeter below and 1 centimeter medially to this we have to insert. So this is the site of IO insertion. Just 1 centimeter below the tibial tuberosity and anteromedially. Now the second step is you have to prepare the site of puncture by first clean with the spirit, then with betadine, then again with the spirit. Now firmly you have to stabilize the leg. So here in this image you can see holding the leg by two hands and should not stabilize under. We have to stabilize just proximal and distal to the site of puncture, and position of the limb should be knee should be semi-flex and slightly externally rotated. Now in this video you can see I am inserting the needle. Needle should be at the side at 90-degree angle. Firmly we have to press. First we will feel the resistance when the needle will reach to the bone, and continually we have to insert. Once you will feel the sudden decrease in resistance, gives way feeling will be there, then you have to stop. So here in this video you can see this 18 gauge needle is inserted into the bone marrow. So in this video you can see I am pushing the fluid by this IO needle, and we have to close with the cap. Then to secure the needle, we have to cut the gauge piece. Sterile, square shape, small size gauge piece. And here in this video you can see, and after that here you can see you have to fix in this way. So then put the adhesive above and below to secure the needle. Then you have to use the syringe to rapidly infuse the 5 ml normal saline. And here you can see I have attached the IV line, and continuous IV fluid should be, we can run or we can give the medication by the IO. So these are the 8 steps of IO insertion. First, localize the site, then prepare the skin with the spray betadine, then firmly stabilize the leg, then firmly place the needle against the site. In this image you can see at the 90-degree angle. Then once the needle reaches the bone, you will feel the resistance. Continuously you have to insert. When you will have the sudden decrease in resistance feeling, then at that point you have to stop. Then secure the needle and then use the syringe to rapidly infuse the 5 ml normal saline. Then attach the IV line, then give the fluid and medication. So what are the drugs we can give through the IV routes? We can give any fluid or medication by the IO route. Fluids, blood component, resuscitation medication, adrenaline, atropine, inotropes, neuromuscular blocker, analgesic, anesthetic, anticonvulsant, sedative, antibiotics, steroids, soda bicarb solution, diluted form, insulin, and various other drugs we can give. When to remove the IO? The maximum amount of time that venous access via the IO route should remain in the patient is 24 hours. In some situation, we can extend up to 48 hours in more than 12 years age group patients if IVSS is not available. Otherwise, we have to remove the IO within 24 hours. What are the complications of IO insertion? Extravasation, infiltration of administered fluid can occur. Injury to the growth plate. So we have to keep in mind that we have to insert just 1 centimeter below the debal tuberosity. Otherwise, damage to the growth plate can occur. Fracture can occur. Osteomyelitis, sepsis, cellulitis, abscess because of the infection can occur. Compartment syndrome and tissue necrosis can occur if the leakage of fluid there. Fate embolism, it is mentioned in the literature but not seen practically. Now, what are the contraindication of IO insertion? So, recent fracture or punctures of the bone at the site of IO, we should not perform the IO at that site. If the patient is having any bone disease, example osteogenesis imperfecta, severe osteoporosis, or if the patient is having bone or skin infection at that site, osteomyelitis, cellulitis, then we should not insert the IO. Now this is the checklist for the uh, IO insertion and the competency P 24.17. We will see the student is able to identify the site, position the limb, insert the needle perpendicular at the 90-degree or not, correctly position the needle and confirmed it, able to secure the needle, able to maintain the universal precaution throughout the process. So thank you so much. This is all about the IO insertion.